looking to get a little nip or tuck in the future, but you're nervous about where to begin, which treatment is right for you, how do you pick the surgeon? Well, here's the guy with all the answers. He literally wrote the book on it. It's Dr. Richard Brown in our Open Door Green Room this morning, getting ready to talk about the new book, The Real Beauty Bible, and how it's changing the way we approach plastic surgery. Thanks, guys. New this morning, plastic surgery no longer a taboo topic, as more and more people are choosing to go for it, maybe not even be so secretive about it. But we've all seen those images of procedures gone horribly wrong. There's television shows dedicated to it, so avoiding that has got to be top of mind. And that is where the Real Beauty Bible comes in. Dr. Richard Brown of Brown Plastic Surgery has written the book on navigating your journey through plastic surgery, and he's joining us this morning with some key questions that you have to ask. So thank you so much. And what a great service this book really fills or provides, because it's expensive to go in and get a consult with a plastic surgeon, right? That's hundreds of dollars just to have a chat.
Oh, for sure. I mean, and you want something like the Real Beauty Bible. The reason I wrote it was just to help people have a guide from A to Z to know exactly what they need to do if they're going to go engage in the process.
Okay, so let's talk first about realistic expectations. What do you find that patients are maybe looking for, that doctors really need to say, okay, I'm going to manage these expectations, and make sure you know what you're in for?
Yeah, Olivia, I think the biggest thing is when I see patients in general, for me, that's really a big part of what I do, is managing those expectations. And so when I see a patient and I talk to them about what they're looking for, breast, body, the work they want, I have to talk to them about this is what you want and this is what's possible, because before surgery, if you can kind of assess that and control that, then they're really destined to be happy with their outcome.
We were chatting during the commercial break about Instagram and social media. We've all got kind of unrealistic expectations of how we can achieve our best look. So you really have to say, okay, you know, that's somebody else's body type, or maybe we're not there yet to do this procedure for you.
Absolutely. I mean, everything that I do is about everyone's different. Okay. This is you, this is what we can do for you. So when people come in with pictures like that, I might say, hey, that might be realistic for you, or it's not realistic for these reasons, and we just try to control that.
Safety has got to be top of mind. So people need to ask the right questions and know what the qualifications are. I mean, we hear these horror stories about botched procedures and people who shouldn't be performing certain operations that really do put your health at risk. So what should we be asking and making sure before we make this commitment?
I think the first thing that everyone needs to hear and hear from my mouth when they go to see someone, you have to ask the question, are you board certified by the American Board of Plastic Surgery? And if they cannot say yes, they are not board certified plastic surgeons in the United States of America. So that's the first thing that they need to know.
And that you're having to keep up those accreditations, and you know that science isn't passing them by. You need to stay really current, right?
Yeah, I just recertified. We do every 10 years, and I just took my exams to recertify just to make sure I still know what I'm doing.
So we're good. He was able to write the Bible.
I passed.
Yeah. What do you think are some of the other questions? I know it can be overwhelming, even when you're doing a well check with a doctor. You put a doctor up on a pedestal, even more so with a surgeon, and you get kind of flustered about what to ask. What are some of the key questions to really figure out, is this the right surgeon for me?
Well, I talk about this in the book, in the Real Beauty Bible. I talk about all the things that are important to know. I think it's important not only to know who it is that's doing your surgery, but I think it's also important to know, why am I having the procedure? Are you the right person to be doing this for me? Is this the right time for me to have the surgery? Because someone who might be having a baby in a year shouldn't be getting a tummy tuck.
Right.
So those are all important things, and the book will take them through that, like, when is this procedure right for me?
And one of the things you mentioned in the book also is about assessing yourself, and is this the right time in terms of, say, weight loss? You want to do some kind of body improvement, but maybe you're still on your weight loss journey. It doesn't make a lot of sense maybe for some of the procedures at that time then.
Absolutely. So that's kind of the future of what I want to do in my practice with the wellness center, is if I have a patient who comes to see me that we know together to get the best result, they still need to lose 10 or 15 pounds, but they've been struggling to do that, we're going to develop a wellness center concept to kind of help them manage what they eat, help them get the exercise portion done, and really dial that in so that they can then have a long-lasting result for the rest of their life.
You walk out of a consult, and there's a few things you should know. You should definitely know what the downtime is and what your limitations are going to be, so that you know if it fits into your lifestyle and you can make those choices. And you also should have a pretty good sense of cost, right? How much can cost vary procedure to procedure, surgeon to surgeon?
I think it varies a lot, because It really, well, surgeon to surgeon, we're usually all pretty similar.
Okay.
But the things that are involved are anesthesia fees, facility fees, and our fees. And depending on what you're doing and how long it takes to do it, the cost usually varies in that way. Now, you'll see that costs do vary between doctor to doctor about how much they think of themselves or the quality of their work. But we're all pretty average in the same area with price.
And if you find one that's a lot less expensive, that might be a red flag, right?
Definitely.
Thank you so much. The book is available everywhere. Congratulations on this.
Thank you so much.
A lot of social media buzz also, so you can order this from Amazon or visit your local bookseller, and we'll have links to his practice as well on Easy Family. Appreciate the insight.
Thanks for having me.